This is Mecca after the Saudi authorities imposed a full lockdown. Islam's holiest site is always packed with pilgrims throughout the year. But these are extraordinary times. From Morocco to Saudi Arabia, governments have imposed restrictions, curfews or closed borders to combat COVID-19. Jordan is under strict indefinite lockdown. Saudi Arabia has the highest rate of infection in the region, while Algeria the highest death toll. In the absence of vaccines to prevent infection, authorities hope confinement will limit the spread.
The number of laboratory confirmed cases might be far less than the actual numbers of cases due to limited testing capacities in some countries. Taking all these points into account, it is still too early to expect the case curve to flatten. We must be ready for all scenarios, and member states should always plan for the worst case scenario.
But despite the measures taken so far, local stock markets are plunging and oil prices are low. As the pandemic shows no signs of ending soon, the region is bracing for a long-term economic damage.
Some of the oil exporting countries are already at fragile situations, such as Iraq and Algeria and other countries, and these countries are very exposed to social unrest, and even some countries in the GCC will face challenges, such as Saudi Arabia, Oman, and Bahrain, with declining fiscal revenue and rising budget and balance of payment deficit.
But this is where COVID-19 might leave a lasting impact. In Libya, troops loyal to warlord Khalifa Haftar have been targeting hospitals used by the Tripoli-based government to contain the spread of coronavirus. In Yemen, the Saudi-UAE coalition announced a ceasefire, citing the pandemic.
If you have the public health crisis with an economic crisis where people are losing their jobs, they might have mass mortality with people dying on the street, I think that will have quite a significant impact on how people view governing bodies.
But it's the Syrian refugees and displaced who might be affected the most. Forced out of their homes, stranded in the border, or confined to crowded camps in neighboring countries, they worry about an outbreak getting out of control. Hashem Ahelbarra, Al Jazeera.